We are tracking rain, wind, and mountain snow. I'll let you know how that will impact your weekend plans. The news starts now.
This is Q13 News at 8.
Concern is growing surrounding the coronavirus tonight as we learn of another possible case in our region. What we know about the person that's now in isolation and awaiting test results.
Plus, travelers nervous about the spread of the virus or making plans for a worst case scenario. Some advice if you have to plan to travel in the coming weeks. More than 83,000 cases of coronavirus reported all around the world, and now growing concern in our region tonight as another person is being tested for that virus. That patient is in isolation at Overlake Hospital in Bellevue tonight. A spokesperson for the hospital says the patient is exhibiting extreme flu-like symptoms. They're hoping to have results from the testing as early as tomorrow. Just want to say thank you for joining us here at the News at 8, though. I'm Brian Flores.
And I'm Jamie Tompkins. We want to take you out to a live picture of the Washington State Department of Health's Public Health Laboratories in Shoreline, where health officials are getting ready to speak about the coronavirus tonight. And it appears as though they are just getting to the podium now. We do expect they're going to be talking about that new possible case here in our region.
That's exactly right. And I think they're about to get ready. And here we go.
Everyone. And thank you for coming tonight. My name is Dr. Kathy Lofi. I am the State Health Officer and the Chief Science Officer here at the Washington State Department of Health. Tonight, the Washington State Department of Health, along with Public Health Seattle-King County and the Snohomish Health District, are announcing 2 new cases of COVID-19 that we are classifying as being presumptively positive. This means that the test has come back positive here in our laboratory, here at the Public Health Laboratories, and is pending confirmation at the Centers for Disease Control and Prevention. We are fortunate enough to have Dr. Jeff Duchin here from Public Health Seattle and King County, and he is going to give you some additional details about the resident from King County who has been found to be presumptively positive for COVID-19. And we also have Dr. Chris Fitters from the Snohomish Health District. He is the health officer at the Snohomish Health District and is going to tell you about a resident from Snohomish County who has tested presumptively positive.
Thank you, Kathy. As Dr. Lofi mentioned, we do have a new case of coronavirus in Snohomish County. We've received a presumptive positive result from the state lab today for a school-aged adolescent. This individual became ill on Monday with fever, body aches, and a headache. They were seen at 2 different clinics, both in Snohomish County, over the course of the week. As the student was feeling better, they did attempt to return to school at Jackson High this morning. The results came back and the student was promptly notified and returned home before attending class. The individual is currently in home isolation as well and is doing well. There was no travel history associated with this case. Our team is still in the midst of the contact investigation, so we do not yet know the possible source of infection. Our staff have notified a very small number of students who came into close contact with the individual, and those students are to remain at home for 14 days. The Snohomish Health District will conduct symptom monitoring during that time. We are closely working alongside the Everett Public School District to ensure the continued safety and health of students and staff at Jackson High School, and I have personally spoken with the superintendent, Dr. Saltzman, and many of his senior leaders, and they have been responding swiftly to this news. They are preparing to sanitize the school's campus over the weekend and are intending to remain closed on Monday. We are also working with healthcare providers in Snohomish County to notify the healthcare workers and any patients who may have come into contact with the new case at the site of care. At this time, there are no additional areas of concern. I can appreciate the news tonight can be distressing to our community. The most important thing we can do is to remain calm and prepared and informed. I encourage you all to monitor reliable news sources, particularly the CDC, Department of Health, and Snohomish Health District websites, and other local public health authorities where you live. We are also actively updating our website during this very fluid situation. I'd like to turn it back over to Dr. Lofi.
Not yet. You get Dr. Lofi again in a minute. I'm Jeff Duchin. I'm the Health Officer for Public Health Seattle and King County. And I'm here to share with you that we have a preliminary positive result for COVID-19 in a woman in her 50s, a female who traveled to South Korea, was visiting in February, earlier 7th to the 23rd, returned to Seattle and worked for 1 day on Tuesday and noted symptoms at the end of the workday when she got home on Tuesday. And on Wednesday evening, her husband called to report her symptoms and travel history to us, and we had her tested yesterday in collaboration with our colleagues from Harborview. They did a home visit and a home testing, and we got the result this afternoon, which is preliminary positive. This patient never needed medical care. She took care of herself at home, had fever, cough, some nausea, headache, sore throat, and like the vast majority of people who have COVID-19 infection, is recovering without complications. She never did need medical care. As I said, she's improving. She has had no interactions with the public during her day at work and has not been in public since her symptoms started. We're in the process of doing a workplace investigation, a contact investigation, and her husband, important to note that her husband, who's been living with her during this time, although he did not travel with her, is well and without symptoms, and he is now under home quarantine. So this is a case of travel-acquired infection, not community-acquired infection. Although, as you know, we have the ability to do more testing now, we will expect to see more cases, including community-acquired cases at some point. So I'll turn this back to Dr. Lofi, and we can take questions.
Great, thank you to both of you. I also want to recognize that this news may be concerning to some people. We appreciate that people in the state are taking, this public health threat very seriously and continuing to seek information about how to stay healthy and to get prepared. Some simple steps I want to remind people that they can take to prevent the spread of infections include washing your hands often with soap and water, staying home when you're sick, covering your coughs and sneezes with a tissue, and cleaning frequently touched surfaces and objects. In addition, people should start making plans for what they might do if their child's school closes. For example, the situation that we're in now in Everett. And people should also make plans to check in. People should also check in with their work about their sick leave and telework options should they need to take care of somebody who is sick at home. As always, our #1 priority is the health and safety of the residents here in Washington State. We are very committed to keeping you up to date on this situation and to let you know about developments as they are occurring so that you all and everyone can make good decisions about how to best protect themselves and their families. So with that, I will go ahead and open it up for questions for anyone up here.
The case in Snohomish County, what's being done about the other students in the classrooms that student was in, or just other people that are in contact? What's the protocol with them right now?
Well, the contact investigation, yeah. So the contact investigation is still, just getting rolling, but the last day he attended, the student attended classes was before the onset of symptoms. So we're really just focusing on those few schoolmates that the individual came in contact with today, also looking at the healthcare settings, but there's not concern at this time about prior to illness, and so there we are. So it appears that no classroom-based contact occurred because the last time the individual was in class was prior to the onset of symptoms.
What is the window of when a person's contagious?
Not my area of expertise. I'll let one of the.
The COVID-19 infection is thought to spread primarily through droplets when someone coughs or sneezes, and thought to be most infectious during the time patients are most symptomatic. There clearly have been reports of transmission from asymptomatic cases, and many of our national public health leaders, Director of NIH, Director of CDC, have stated that they believe asymptomatic transmission can happen. We have no idea how common that is. We think it's relatively uncommon and not a major route of transmission, although we're still learning a lot.
Can you elaborate on, so these two cases, I mean, the high school student, this was a teenager, how do we know how they got the virus? I mean, they did not travel to Asia recently. Is that correct?
Yeah. Yeah, so that is correct. So the individual in Snohomish had not traveled overseas and had not been in contact with anybody with a known COVID-19 infection. So part of the investigation, will involve interviewing this individual, finding out had they been in contact with anyone who may have traveled. So, we're just sort of in the beginning stages of that investigation to see if we can, try to identify how the person may have become infected.
So it's correct to say that this is the fourth case in the United States, the Snohomish County one, where the person did not travel to Asia. They got the disease here. This is only the fourth in the United States, a teenager?
This person did not travel, so it is concerning, since this individual did not travel, that the individual acquired it in the community.
I'm curious to know then how you can say that the risk of transmission, it's not something that people should worry about if this teenager, of all people, didn't even travel to Asia. How can you say that the risk is low if they just randomly got it and that they're at a high school?
Yeah, so we have been saying that the risk is low because, up to this point, that's what we've believed the risk was low. Now that, we have the assay in our state public health laboratory, we're going to be able to test more, and we're going to find more individuals. So we really believe that the risk at this point is increasing.
So this kid's symptoms were so minor that he was getting ready to go back to school, and then the other person, the 50-year-old, was, again, symptoms were so minor that they didn't need to go to the hospital, they were treated in-house. And so with that, it's possible there's a bunch of other people that have it, they just have no idea.
That's right. Yeah, exactly. So this disease primarily causes relatively mild infection. 80% of people who are infected have an uncomplicated illness, don't require hospital care. So because our national testing criteria, because of limited availability of tests, is focused on more severely ill people, we are not aware of whether or not there are people in the community who have mild illnesses that look just like a common cold or a mild flu that may be due to COVID, and COVID-19. And so when we say we're expecting to see more cases, we're anticipating that now that we're able to do more testing, we will find more mild cases in the community. And so people shouldn't be scared of that. People should understand that this disease is likely to increase, as it has in other countries, that it's predominantly a mild illness, although in some people it can be severe, and that there are things we can do to decrease our risk. And that's really what we need to focus on now, because as we've all been saying, from the local to the national level, we're expecting increasing cases, and once this happens, we're going to need to focus on more community-based measures than trying to chase down every case, which is not going to be possible. So everybody needs to understand what they can do to decrease their risk of getting infected, which is, as Dr. Lofi said, really serious attention to good hand hygiene. More hand washing, less face touching. Don't touch your eyes, don't touch your nose, don't touch your mouth unless you've cleaned your hands first. Don't go to school or work if you're sick. Please have consideration for your community members. Do not go to school or work if you're sick, especially if you're a healthcare provider. If you know other people are ill, stay away from them. And then we're going to be increasingly recommending that people try and avoid crowds and close contact with other people as we see more cases occurring. So folks should be prepared, as Dr. Lofi said, for what might happen if schools close, and businesses should have plans in place to make sure that they can promote telecommuting and not have meetings where people have face-to-face contact, and allow people to have flexible schedules. Again, all strategies to decrease the likelihood that people will have close contact with one another. We may get to a point where we want to recommend canceling large public gatherings, social events, sporting events, things like this. entertainment until we get over a hump of what might be a large outbreak. We don't know what to predict at this point. We don't know how severe or how big an outbreak will be. That's a really important point. But we want to be prepared to make whatever challenge we face as least impactful as possible. So we want to have fewer infections if we have a choice, and we want those infections to be spread out over a longer period and not all happen at once. So schools, businesses, workplaces, everyone needs to look at what they can do. There's great information on the web, the CDC's website, NPI, Google Non-Pharmaceutical Interventions, or CDC NPI. You'll see what you can do as an individual, family, school, workplace, communities. We all need to work together and take these steps to decrease the risk of becoming infected and spreading it to others.
Jeff, I'm curious, because this is scary stuff when you're talking about like canceling ball games, sporting events, entertainment, and that spread. But when you have some folks who didn't even know that they were sick, the symptoms were so minor and asymptomatic, how can we balance like the responsibility of saying, like, if you feel sick, you should be doing this now, versus like, hey, not putting out like a giant amount of fear?
Well, I'll start. I'm sure others will have thoughts on this.
I'm curious because like we're gonna sit here, we're gonna put out all the information you guys said, but like when you have a kid who's like, I didn't even know I was sick, like how can we balance like the concern, doing the right thing, like the gentleman behind you talked, so it's like, if you have minor symptoms, should we all be going to the hospital now to get these tests?
Yeah,
So
what we're trying to acknowledge here is that over time, the number of people who are infected will likely increase here and elsewhere in the country. And we can do something about that. We can take steps to reduce our risk of becoming infected, and we can take steps to reduce the risk of having the infection spread in the community and having an unnecessarily large number of people get sick and need health care. So by taking these steps of hand hygiene, not being around others who are ill, staying home from work or school if you yourself are ill, and staying away from others through social distancing, we will decrease that risk. So we have tools to decrease the risk. We can't 100% stop this virus from spreading. It's probably going to become an annual virus like many of the other coronaviruses at some point. We will become immune to it, more immune to it as a population. It won't cause huge outbreaks in the future, most likely. But this is the first time, and most people don't have immunity, so we need to take these special steps. So the idea is, don't panic, be prepared, because there are things you can do to reduce your risk, the steps that we've mentioned. And the measures that we are taking shouldn't scare people. The measures that we are taking and may recommend are to help decrease their risk.
So in the absence of travel to an outbreak area, what are researchers looking at as the possible ways that these people are acquiring coronavirus? Are there a range of things that are being examined right now? I mean, like, in my mind, I'm thinking like a product is shipped overseas and it's a hardy virus that's living on the product, but what are they looking at right now?
Yeah, so just a point of clarification, viruses are not living things, they're really just protein packets. So how long a virus remains viable on a surface or a package is fairly limited with this virus. So it's not like a package is going to come from China and still have a viable variant in it. So those kind of concerns aren't there. It's, as Dr. Duchin and Dr. Lofi said earlier, this is mainly spread through people that are generating droplets, and it's landing on other people who are not washing their hands, and that's our biggest risk factor. Even this young gentleman was exposed to someone and obviously got infected from a respiratory pathogen. So that's the trick as we're in the midst of this, learning what are the most common pathways of travel. To begin with, it was the travel from China. What we're up here telling you now, the more we test, the more we are going to find this virus that aren't related to the initial pathways of travel from China. They're going to be in our community, they're going to be in other countries, and we need to start doing those practices now that protect ourselves here in the United States. Again, not panicking, but using your brain and actually being prepared for this and understanding what's new and evolving about this virus. It's a new virus, so we're learning as we go.
How well equipped are we to test all the people you're going to need to start? I mean, you're going to need a lot of tests.
Yeah, so you're sitting here in the State Public Health Lab where we brought on the test. There is no backlog. for us to test. So I do assume, as you heard Dr. Duchin say, we have broadened the criteria for who we will test. Obviously informed by folks we see in the community. And we are running at least 2 shifts a day of these tests. So the capacity is good right now. There still is the CDC who can do this test, but the nice thing about Washington State is we're hearing about these cases that we got the results in a day. So that's where we're at right now.
And you'll be testing asymptomatic.
All right, so if you are just joining us right now, we're getting some big news from state health officials tonight. They're saying there are 2 new cases of COVID-19. They're calling them presumptively positive tonight. They're saying 1 case is in King County, 1 in Snohomish County. Now, as for the one in Snohomish County, according to the health officer there, it's a school-aged teen seen at 2 different clinics over the week. They say that teenager returned to school at Jackson High before the onset of symptoms. The test came back positive and the student was sent home to be in isolation. There's no travel history in this case, no contact with anyone infected that they know of just yet. So really no idea on a possible source of infection here for this student. They do say that a small group of students came in contact with this student. Those students are also going to remain home, and Jackson High School will be sanitized over the weekend. They say that school will be closed there on Monday as well. But again, we're talking about 2 cases here, 1 in King County, 1 in Snohomish County.
And I think that's the one that they're really concerned about, because especially because there wasn't a travel history. The other case, really briefly, is a woman in King County. She is in her 50s, according to health officials. She recently traveled to South Korea, and then she got back earlier this week. Her husband said that she started developing symptoms and that she actually got tested on Wednesday, and that's when that test came back presumptively positive. Again, both of these cases are that presumptively positive description. They're also being tested with the CDC, they tell us, and that should give us a more clear direction in terms of a more whether this is actually coronavirus, but we should assume that it is. But again, we're getting 2 new cases here of presumptively positive coronavirus.
And one big message that they said, the big takeaway from this press conference, they want people to remain calm, be prepared, and of course, stay informed. They said this is spreading through coughing and sneezing, and people are most contagious when the symptoms are most severe. So of course, they're saying stay home if you're sick, and of course, the number one thing that they can offer, the one piece of advice, is just wash your hands at this time, especially because we're in flu season right now.
Yeah, it's sound advice anytime. AJ Janavel is at that press conference. He'll have more throughout the news tonight, but we'll be right back.